If you're a dentist and you want to incorporate orthodontics into your practice, whether or not you're a general dentist or a specialist or a pediodontist, and you want to grow your practice and build financial independence, then this video is for you. I got several questions today from a pedodontist who wants to start offering orthodontic services to her patients. So let's go through her questions because these are questions that I get often. By the way, I'm Dr. Nagy. I specialize in teaching orthodontics to general dentists, specialists, and pedodontists so they can grow their practices and treat patients with orthodontics as well as to build financial independence while they're living their best lives. So the first thing that she asked is, what is our usual and customary profit margin for Invisalign cases? She's planning to do Invisalign for her pediatric patients who are younger than 18. So in general, I recommend not using aligners or Invisalign for phase 1 cases, which is basically under 10 years old, but using brackets and wires because a lot of those patients need expansion and it's much, much easier with brackets and wires and your overhead is a lot lower. Now, you can use aligners for some mild cases that are older than, maybe 11 years old. So basically they have a permanent dentition, so maybe older than 12. And if they have mild crowding and you don't have any major things to correct, a lot of times you can use aligners. Now, back to the question is, what is the profit margin for this? You really have to set up your fees as your orthodontic fee plus the lab fee. So in general, that's how we set up our orthodontic fees and our profit margin by determining what this case is going to be involved. Of course, if it's going to be more appointments, it's going to have a lot more involved case, then you're going to raise the fees. And then you also have to add the lab fee to that. So if you're going to use aligners, you need to add the lab fee of the aligners to your orthodontic fees. Or for example, if you do use a herpes appliance or you use an expander, things like that, you would add all those fees to your orthodontic fee. And your profit margin is hugely dependent on your practice. If your practice already met the break-even point, your profit margin is going to be much, much larger. It could be anywhere between 50 to 70%. If your practice have not met the break-even point and it's a growing practice, then your profit margin is going to be much smaller. So it really depends if it's an established practice or if it's a growing practice. So in general, it's very difficult to say what your profit margin is, but I think it will be, for a mature practice, it will be very fair to say that for an average orthodontic case, it's probably 50% easily. Because remember, it also depends on chair time and treatment time, how many times you're going to see that patient, because orthodontic fee is a total fee. It's not like a per appointment fee, but a lot of the orthodontic appointments are done by the assistant. And if you're going to use aligners, usually aligners don't take that many appointments, and it's not very involved in terms of chair time. So if you're careful picking your aligner cases, you can be quite profitable. But where I see a problem, what a lot of people do is a lot of doctors set their aligner fees too low. So make sure you don't set your aligner fees too low because you also have to account for the aligner lab fee. Her next question was, do we buy or rent a scanner? And she was asking about the iTero scanner. We use the iTero scanner. I really like it. It works really well for Invisalign cases as well as for regular crown and restorative dentistry cases. It's also great for expanders and things like that. But I wouldn't rent one. I would probably just buy one. And there's a number of scanners out there, but you have to make sure that you check if they're compatible with the aligner company that you're going to be using. So you want to make sure you check for that before you buy one. We use an iTero scanner, and we have actually 2 of those, and they work really, really great. And basically, most of the scanners will work really well. You just have to check compatibility with the company that you're going to be using the aligners from. Her next question was, how soon the staff became familiar and competent with the scanning patients? Actually, that's really, really quick. Usually, we have a 2-day team training program where we teach doctors and their staff how to provide orthodontic services. And most staff get really familiar with scanning within 2 days. And after that is just practice, but they're really competent scanning after basically 2 days of practice. So it's something that usually assistants love doing, and they get really good at it really quickly. So it's not a problem at all. The next question was, how much time do we spend training staff to place attachments for aligner cases? You have to check your state law for this because, for example, in my states, only doctors are allowed to place brackets and attachments. So you really have to check your state on legality of this. I can tell you it's going to take the same amount of time to train assistants as it is to doctors. And for teaching doctors how to place attachments, we usually do that in our 2-day staff training course. And that's our orthodontic team training program. So it doesn't take long at all. It's usually just a Friday, Saturday course. And her next question was, how long does it take for a team to become competent with providing orthodontic services? With aligners, it's very quick. It's really about a 2-day course, and after that, maybe a month. For braces, it's the 2-day team training course, and after that, usually about 3 months, and they're really good at a lot of the orthodontic procedures. So I would say about 3 months for regular braces, wires, and brackets, and for aligners, maybe about a couple of weeks to a month at most. Her next question was, how did we introduce orthodontic services to patients? Usually what I recommend is what we did. All you have to do is just make patients aware that you provide orthodontic services to your patients, because patients love orthodontics. They want to have a better smile, and this is not something that you have to sell to them per se, but it's something that they actually want and they seek for, especially adults. And don't underestimate adults too, because kids really want braces too because they get crooked teeth, but adults a lot of times put their kids first, and then there's a big need for orthodontics in patients who are 35 to basically 60 years old. We have a lot of patients who are in their 50s and 60s and definitely in their 40s that want orthodontics, and they want to have beautiful straight teeth. So in terms of making, selling or marketing orthodontics, all you have to do is just really make patients aware of. And social media is one of the best way. Also ads on social media, as well as Google ads, as well as banners and just different pictures, before and after pictures at your practice. Those are great. Make sure you take good photos, especially before and after photos, because those really go a long way in terms of helping patients be aware of what great services you provide for them. And so you're just really building awareness is one of the best things. And I teach that in my coaching program too, but we also teach this in our 2-day team training class as well. Her next question was if we have a sales course to teach the team how to sell orthodontic cases. Like I said, we do. It's part of our orthodontic mini residency. That's an online program to teach dentists and specialists how to provide orthodontic services, as well as the team. We do teach all of this in that program: how to market it, how to advertise it, how to make patients aware of this. So you don't really have to take your staff to like a marketing course. What I would recommend is just basically our team training course, and we offer this to to doctors twice a year, and it's also going to be available online this summer. So if you have any questions, feel free to reach out to me, and my link is in my bio. But I wouldn't recommend like a sales course per se, because all you have to do is just build awareness for orthodontic services. Her next question was, do we devote one chair or one column to orthodontic services when you first start out? And my answer to this, at first you do. At first you just kind of put patients where you can, or where you just devote maybe like one chair. That's maybe like the ultimate goal, but eventually orthodontics is going to take over your practice. One of the best way to double your practice within 24 months is with orthodontics. If you don't provide orthodontic services to your patients now, if you want to double your practice, you will. It's going to take over, because so many patients want orthodontics, and they'd be super excited about it. And it's not just kids, and not just kids under 18, but also adults. Adult patients love having straight teeth, and it also helps reducing gum disease and cavities, because patients are just able to clean their teeth a lot better. And like I said, all you have to do is just build awareness, and it's going to really grow your practice. And I would recommend devoting one column at first, and after that, you're probably going to have more than one column of orthodontics in your practice. Her next question was, do we give any promotional items to patients? And answer is we do. There's several items I really like. I really like a t-shirt that we give to patients, and I would recommend the Tri-Blind Super Soft t-shirt. And the one we have, actually, I designed it. The front just say, I got my braces at Oakwood Dental, and the back just says, I got my smile at Oakwood Dental. So, but you can design anything you want. But the only thing I recommend is make sure you get a really high quality t-shirt, which I like. The Tri-Blend t-shirt is the best. After that, pizza cutters are super popular, as well as stress balls. So you can get the biggest thing I recommend is it's something that patients want, something patients are going to use, and it's something that's not super expensive. Like I love t-shirts because patients going to wear it around town, and a lot of patients love our t-shirts so much. We have patients who moved away and they still come back to pick up another t-shirt after it's been kind of worn to death. So, but definitely get a soft t-shirt that's really comfortable to wear. So I really like these promotional items, and try to experiment with a few, but make sure you get high quality items, because last thing you want to do is give patients like a pan that's going to leak all over their pocket and ruin their favorite clothes. So make sure you try the items first before you give it to patients. If you have any questions, of course, we have our orthodontic mini residency where you and your team can learn to provide orthodontic services for your patients and grow your practice. So if you have any questions, my link is in my bio, so check it out. And don't forget to keep smiling and keep thriving and build better habits for prosperity.